There is finally an end to the more than month-long strike of Allina Health's nurses.
Union leaders endorsed a new contract. More than 5,000 nurses covered by that. They endorsed it last night, and everybody voted for it, at least enough to pass it. Kate Raddatz live outside United Hospital in St. Paul with the details of the vote. Kate?
Well, Jason, the members of the MNA voted overwhelmingly late last night to accept the latest contract offer from Allina. So this strike, it will officially come to an end when the nurses have to return to work on Sunday. Now, the union and Allina Health agreed to a deal after a nearly 17-hour negotiating session at the governor's mansion earlier this week. The two sides have been negotiating for a total of 9 months. The big sticking points have been for their health care plans and safety in the hospitals. Now, we're told as part of this compromise, nurses will get to keep their current health care plans now, but they will be phased out by the end of 2018. It also promises to improve workplace safety and staffing policies. About 4,800 nurses at 5 Allina hospitals have been on strike since Labor Day. 630 nurses had since crossed the picket line and returned to work.
The nurses left their jobs and their health benefits so they could win workplace safety guarantees such as better training and around-the-clock security guard in the emergency department. They won that for both themselves and for their patients. While it's certainly nowhere near what the nurses deserve, nurses can hold their head high.
Allina released a statement late last night saying that they appreciate the nurses' ratification of the agreement. Now, it's unclear right now just how much this strike is going to cost the hospitals, as the nurses had also gone on strike back in June. That only lasted about a week, and it cost Allina more than $20 million just to find those temp nurses.
Yeah, just for that short period of time. So who knows how much it costs them over this. The nurses and hospitals were really getting nowhere, Kate, until the governor called them to his house to talk. Any reaction from the governor on this?
Well, Governor Dayton, as well as the lieutenant governor, they both said that they were grateful that both sides had finally come to an agreement that the strike will end. But they also said that they recognize Minnesota nurses are on the front lines of health care, where they work tirelessly and professionally to take care of all of us.
All right. Kate, thank you.